Thank you, Dr. Goggins, and good morning, everyone, and thank you for coming today. Just before I dive in, I'm going to be introducing a program that we developed looking at individual exposure to poor air quality. But before we get there, I'm just going to go through some background knowledge just to give you a little bit more on air quality. So to start off with, this graphic shows a pretty good breakdown of the size of particles compared to a human hair. You can see the size of particles that we are used to seeing, so the sand or salt, all the way down to the smallest particles like viruses that are not normally visible without magnification. So one thing to note is that I'm going to be referring to particles either as particles, particulate matter, or I'm going to shorten it to PM. And when talking about the size of particles, a number can be added. So for example, inhalable particles are particles 10 micrometers or smaller, or what we would call PM10 or smaller. The particles that warrant increased concern, and the one that's going to be the main topic for this presentation, are PM 2.5, which are particles between 2.5 and 0.1 micrometers. So in that range there. Particle size plays a major role in determining their deposition location in the lungs. Deposition refers to the process of particles becoming trapped in the respiratory system and not being exhaled. This diagram shows the predicted lung deposition for a person with a 750 milliliter tidal volume, taking 15 breaths per minute with a lung volume of 3,375 milliliters. During inhalation, the nose and upper airways act as the body's natural defense lines, and they'll catch some of the particles, but many are still going to make it into the lungs. So the larger particles, such as small dust particles, any of those that make it past the nose and upper airways will primarily deposit in the bronchi, which is shown in the blue area. And this happens via impaction, which is basically the crashing of particles into the airway surfaces as the air kind of tumbles them around while you breathe in. Particles around 1 micrometer in size, so a little bit smaller, they make it further into your lungs, into those yellow areas. Deposition occurs mainly due to sedimentation, which is the settling of particles onto an airway wall based on gravity, as well as to a lesser extent diffusion, which is dependent on random movement of particles from a high concentration to a lower concentration. The very small particles penetrate even further into the lung tissue, into those red areas, and deposition occurs mainly by diffusion. It's important to note that particle size can actually be altered upon inhalation. Some particles are going to absorb moisture and actually expand. And as I mentioned earlier, we are particularly concerned about PM 2.5. And this is because they can bypass the body's natural defenses and penetrate deep into the lungs. And this makes it harder for the body to clear them, increases the exposure time, and increases the risk that the particles will enter the bloodstream and travel to the rest of the body. Once deposited, the body does have clearance mechanisms to remove the particles. However, these mechanisms are not perfect, and the time it takes is dependent on the size, location, and the total number of particles. For particles that are deposited in the upper airway, mucociliary clearance moves the particles up towards the throat, where they're expelled either through the mouth and nose, like a cough or a sneeze, or they're swallowed. And swallowing these particles can have an impact on the stomach and intestines, possibly leading to conditions like stomach and colon cancer. This is only one example of the systemic impacts of PM, and we'll get into that a little bit later. And this method takes between 2 to 24 hours to clear the deposited particles. Now, for particles that are deeper in the lungs, the immune system responds and transports the particles into the blood vessels for the body to clear. This immune response can lead to inflammation, as well as exposing the rest of the body to the particulate matter. This method can take more than 24 hours or even upwards of months to clear the particles from the body. This clearance time results in exposure well beyond the actual time spent in poor air quality. Exposure and dose are impacted by several factors. The dose of inhaled particulate matter depends on the deposition in the lungs and the clearance. And either or both of these may be altered in susceptible populations, leading to an enhanced dose. Larger lung size increases lung volume, which also increases deposition and can also lead to a greater inhaled dose. Men have larger tidal volume and higher minute ventilations. This means that their overall dose inhaled is higher, while women, on the other hand, have higher airway resistance and smaller airways. This increases deposition, although primarily in the upper airways. And overall, women may have increased deposition in terms of surface area in the largest airways due to their smaller size. However, they may also have less deposition in terms of surface area in the deeper lung due to the smaller minute ventilation. Age can also have a significant impact on exposure. Children will have a higher upper airway deposition due to anatomical size. Older adults with normal lung function should have minimal changes in tidal volume and minute respiration. So there should be no changes in deposition patterns. Where this change will be seen is if there's a presence of diseases and conditions like COPD or asthma, as these do have an impact on deposition and inhaled dose. As COPD progresses, deposition will worsen, increasing up to 5 times, and partly due to the airway narrowing, but also mostly due to the increased ventilation. Similarly, in asthma, deposition is enhanced in the proximal airways due to constriction. Now, during exercise, tidal volume and breathing frequency increase. This also increases the deposition as well as the inhaled dose. Particles of all sizes deposit more with increased tidal volume. However, there is changes in deposition pattern with less in the lower airways due to the increased breathing rate. Ventilation at rest is assumed to be 10 liters per minute or less, while heavy work can be upwards of 80 liters per minute up to 160 at max intensity. On this chart, I have placed the MET values over the ventilation ranges for each level of intensity. And typically, 1 MET is equal to 7.5 liters per minute. And this is a concept we're going to come back to a little bit later. Once the particles have entered the body, they can cause damage in 2 ways. Direct tissue damage is at the site of exposure, and indirect effects when particles and inflammatory mediators enter circulation. Direct effects include eye, nose, and throat irritation, and can lead to conditions such as inflammation and fibrosis of the tissues in the respiratory system. Indirect effects can impact a wide range of areas as the particles and inflammatory mediators are transported throughout the body in the bloodstream, or as particles are swallowed. These effects can be short or long-term and can span a wide range of symptoms and conditions. Many people are familiar with the short-term effects of poor air quality, like coughing, eye, nose, and throat irritation, and allergies. However, the long-term impacts are often less well known. This diagram shows how the short-term exposure to particulate matter can have long-term impacts. Exposure to particulate matter can trigger mechanisms such as oxidative stress, DNA damage, and chronic inflammation. These mechanisms can lead to the development of conditions such as strokes, cardiovascular diseases, COPD, diabetes, other immune diseases, and respiratory infections. Specifically, the ability for exposure to change DNA can be cancer-causing, reaching beyond the lungs. Exposure to particulate matter, specifically the inflammation that it can cause, may also worsen chronic diseases including diabetes, autoimmune diseases, arthritis, obesity, fatty liver diseases, and cardiovascular diseases. While air quality should be a concern for everyone, some occupations have a greater risk of exposure. For example, the wildland firefighters are exposed to known hazardous conditions for long work shifts. Not only do they work 8 to 12 hours in poor air quality, but they're also often living and sleeping in these poor conditions. The map that is shown on this slide is a screenshot from a program called PurpleAir. It uses sensors that measure PM 2.5. PurpleAir shows the air quality across the world, and they have records dating back as far as 2016. By selecting a bubble, it brings up an information box that shows the current air quality and the average from the last 10 minutes all the way up to the average from the last week. The Air Quality Index, or AQI, separates air quality into 6 color-coded categories, starting at good for green, all the way through hazardous in maroon. This is the color code that PurpleAir also uses, and it's also what we used in our tool that I'll show you on the next slide. The World Health Organization does have a 24-hour guideline that says that PM 2.5 should not exceed 15 micrograms per cubic meter per hour. And wildland firefighters can routinely be working in orange, red, purple, or even maroon conditions, making air quality monitoring, analysis, and protection a high priority. So this is the tool I was mentioning, and this tool was created to calculate the exposure that wildland firefighters experienced while deployed. The dashboard allows you to select a date range by specifying the start and end dates for deployment. And then using PurpleAir data, it will provide a summary including the average AQI, max hourly AQI, and the number of days included in the deployment. It also provides a cumulative air quality analysis, highlighting how many hours were spent above the WHO standard. While the cumulative exposure isn't something that is routinely used, in a case like the wildland firefighters who remain in smoke-impacted areas during work and non-work hours, it does create a more complete picture of their total exposure, providing a better sense of their total dose over time, rather than just objective good versus bad hours. So in addition to that, the dashboard also calculates the average cumulative exposure in micrograms per cubic meter times whatever hours would be included in that deployment, as well as the comparative WHO standard for that time frame. The bottom number shows the excess exposure above the WHO standard, and all of the colors will change based on the AQI scale. With wildland firefighters working and sleeping in outdoor conditions, it's important to consider the sleeping conditions and intensity of exercise or work being done. The tool allows you to toggle on and off sleep protection analysis and an exercise/work analysis. The sleep conditions feature allows you to select where the workers sleep, choosing from no sleep protection, indoor sleeping, tent sleeping, and HEPA filtered sleeping. Each of these choices will protect the worker differently from poor air quality, which is reflected by the program decreasing the AQI levels from 8 p.m. to 6 a.m. by the predetermined percentage. The values adjusted by sleep conditions are shown in the middle ring on that circle on the right side. When adjusting for exercise or work, the values are changed by the estimated minute ventilation of the workers. The chosen values are based on the estimated MET values that would represent each level of activity. So as I mentioned, 1 MET, which would be like sitting, is equal to 7.5 liters per minute. Light work is 2.5 METs, so that would be like a slow walk, and that's equal to 20 liters per minute. Moderate exercise, which would be like a brisk walk, is represented by 4.5 METs, or 35 liters per minute. And heavy work, which would be like running or jogging, is about 6.5 METs or 50 liters per minute. Now, it's important to note that some of the factors that change deposition also impact minute respiration. So specifically, minute respiration is dependent on the worker's weight as well as their sex. However, the values chosen for this program are conservative, meaning that the exercise likely contributes to more exposure than what will be calculated for the majority of workers. In addition to working outdoors, wildland firefighters are often expected to complete some kind of workout or exercise when they're not actively deployed. While this tool does not calculate this directly, it can help provide the workers with information showing the impact of exercise and the importance of having time to recover from exposure to particulate matter, ultimately helping them make choices about when or even if to go outside for exercise. So just to give you a closer look, in both of these images, the outer ring represents the change to sleeping conditions. The picture on the left is when the workers are sleeping in a tent. None of the colors, as you can see, change on the outer ring, as a tent provides very little to no protection to reduce exposure. The picture on the right is when the sleeping conditions are in a HEPA filtered house. And as you can see, some of the exposures have actually moved down a level. Overall, this tool provides a way to move beyond just air quality monitoring to understanding individual exposure risk in occupational settings and conditions. And just before I finish up, I want to revisit PurpleAir's dashboard to highlight one of its features. PurpleAir has many different data layers, as well as different options to toggle on and off to filter and kind of explore their data. The one data layer we're particularly interested in allows you to show the PM 2.5 as represented as cigarettes per day. And for those interested, a general rule of thumb is that a PM 2.5 of 22 micrograms per cubic meter is roughly equivalent to one cigarette. We think that this would be an effective way to communicate the data to the general community and possibly to workers as well, as it expresses the hazard of poor air quality using a metric that people are more familiar with. And we do currently have a research project in the works that uses this comparison to represent the AQI in addition to the micrograms per cubic meter layer that PurpleAir already offers. Thank you all for taking the time to listen today, and I'm happy to take any questions.
Awesome. Thanks, Manny. We do have a question in the chat here. And so it's from Kevin. He's asking, have you looked at the accuracy of the PurpleAir for PM 2.5 when compared to other instruments?
Yes. So there is a discrepancy, I guess you can say, that PurpleAir has. And that's particularly evident with like overestimating the smoke with forest fires. Um, that being said, the tool that we're using um, kind of is conservative on all aspects. So we're assuming that all the data we're coming out with is kind of underestimating. So that sort of bounces back both the minute respiration calculation for exercise as well as the possible error count between different sensors.
Awesome. Thank you. And the overestimation, so do you think a lot of it has to do with the use case of the PurpleAir in this case? Is it a lot of it with like the proximity of the detector to the fire, or just like I know we've seen the map where it's like bigger generation. Is there greater discrepancies based on like proximity to the fire,
Yeah,
or yeah.
yeah, definitely. And that's the one thing with PurpleAir is that some areas have a higher density of sensors. So in some cases, you're looking at a sensor that's like right next to the source of the fire versus maybe your closest source is a couple kilometers away up to a few hundred kilometers away. So it depends too on how close the sensor is to the area you're actually wanting to measure. But yeah, there's definitely a couple different factors that can be play there.
Awesome. So we have another question here. With a baseline mediocre air AQ in downtown Toronto, how can we get an accurate idea about the impact of wildfire smoke on our outside workers, especially in the PM 2.5 range?
Um, so hard to say because what's coming out with the PM 2.5, like the health effects of the smoke versus just PM 2.5 on itself, there's similarities and differences. So the level itself still plays a role, but also like whether or not there's a presence of wildfire smoke is also going to be a consideration. Um, but yeah, so having the idea, like generally assuming that if there's a presence of smoke, not you can't judge based off of whether or not you can just see it or even smell it, because we've seen days where the AQI can be really high when you wouldn't be able to tell just by walking outside. So yeah, paying attention to any sort of um, sensor data that you're getting, whether that be PurpleAir or the uh, weather network or wherever you're getting your data from, it'll give you a pretty good idea on the health impacts.
Yeah, so definitely. I think this is like a prime case of where the development of the interface and like how that's interpreting the technology and the data from the sensors, and how we're, getting that out there is going to be the primary kind of finding here. So we have one question. So Judith's asking, is there a portable sensor for this device that can be easily moved? So with the PurpleAir, it has to be plugged in. What are the constraints on the PurpleAir for like using it?
Yeah. So I haven't actually set up PurpleAir myself.
Hmm.
But yeah, it has to be plugged in. So like you have to be close to a power source, and that's going a lot of the time. That means that people have them indoors even sometimes, which impacts the readings that you're going to get anyways. But also if it's in your driveway attached to the side of your house, you're going to get readings from cars and you're going to get readings from all these other different things. So there isn't like a constraint in that aspect. Um, the I don't know of any portable sensors. Definitely not by Purple Air, but
No,
yeah,
yeah. So yeah, the way they set theirs up. So yeah, so the one of the limitations here is this is yeah, it's definitely got to be plugged into power, so it needs a power source. But also for that lovely dashboard that you're seeing, it also needs to be on Wi-Fi. And so both of those things have to happen. So sometimes it can't be like perfectly located and moved in different locations. And so Andrew's just making a comment here. Last summer, the MOL refused to even take a measurement on one of the days when the smoke was really bad. And so yeah, there's some evidence there of what happens when the visible smoke, everyone can make like a, kind of a conclusion about whether or not to exercise in that. But when it's the other factors that are, leading to AQI calculations, when it's those factors, it can be kind of difficult to make those decisions. And so that's the purpose of this project here. So I'm going to thank you, Manny. That was a great presentation. So thank you for being ready, stepping in there, and we'll move on.